So, I want your opinion on something kind of controversial. Have you heard of something called VSED?
Voluntary stop eating and drinking. Yes, you had some great questions, and hopefully I can help. As you said, VSID is legal everywhere in the US and is different from medical aid in dying or MAID, which is not legal in all states. VSID is when a person can hasten their death through stopping eating and drinking, as the name implies, at any stage of their disease process. For medical aid in dying, the person must be within 6 months of the end of their life and will self administer medications to cause their death. You asked if VSID is considered, we will call it self-unaliving so my video doesn't get banned. If someone was to do VSED without a terminal illness, then yes, it would be that. I'm really not sure how many people would actually choose to die in that way. If someone is going to die by that, they are usually going to opt for a quicker experience. They don't really want to die. They're trying to escape the pain of living. Starvation and dehydration would be counterintuitive to that, as there can be some suffering through it if there's no support from hospice, which they would not qualify for. Terminally ill people who utilize VSED usually have a neurodegenerative disorder such as dementia, Huntington's, or ALS, because they almost always can't qualify for MAID. So how long does it take? Well, we typically say that VSED will cause death within about 7 to 10 days. I did have a patient once who had ALS and she died by VSED, but she was only willing to stop eating and couldn't give up her daily cup of coffee, so she actually lived for 3 weeks. Her death certificate stated the cause of death as ALS. Death certificates for hospice patients who die by VSED or MAID will always state their cause of death as their terminal disease. Hope that helps. Let me know if you have more questions.